Hello, my name is Tiffany Stensvad, and I'm going to be discussing today the implementation and increasing of perinatal depression screening, diagnosis, and patient-centered treatment. The needs assessment for perinatal depression was actually very interesting for me. The perinatal depression is a national problem and severely underdiagnosed across the country. In Montana alone, in 2016, 75% of mental health care needs were not met. Worldwide, about 10% of pregnant women and about 13% of women who have just given birth experience a mental disorder, primarily depression. However, sometimes that is anxiety as well. That's usually about 1 in 10 women have some sort of mental health problem during pregnancy or within the first year after delivery. There are many contributors to depression. Some of the main ones that we see are poverty, violence, drug abuse, and lower education levels and family history. According to the WHO, no health without mental health is one of their new slogans. The point was made that addressing the major burden of mental health problems in resource-constrained countries and systems is essential for development. DNPs can help by just simply making sure that patients have received screening and are appropriately following up with care, medication, supplementation, and other resources such as counseling. Becoming familiar with the medication safety in pregnancy is paramount in order to do effective screening and treatment in mental health. St. Vincent's can help in implementation with early depression screening in pregnancy, educate their providers, and become familiar with our local resources. The learners for this program are going to be ages 35 to 62 years old. Races are Caucasian, African American, and Hispanic. The gender is predominantly female. Reading and writing level, high school diploma, or doctoral level. So there's a wide range of learners that I will be teaching. Skills are from medical all the way to office staff to even just the clerical. All we have are kids that are in doing some filing, and they'll be in on this as well. Primary language is English. Cultural considerations in this particular clinic is midwifery and a medical model, which are two very different types of practice. Goals and objectives. By the end of the presentation, the learner will be able to implement depression screening in any clinical setting for perinatal women. Objective 1, the provider will be able to discuss the need for depression screening during prenatal appointments for pregnant women. The provider will be able to demonstrate the ability to construct a provider toolkit for perinatal depression screening in a prenatal clinic. And the provider will be able to explain effective follow-up and current recommendation for treatment of depression during, before, and after pregnancy. My method of instruction will be PowerPoint instruction and demonstration, simply because they are both cost effective. It engages all types of learners, and it is quick, and you can give handouts with either of them to supplement the learning. Demonstration itself reinforces teachings by doing. The first literature review article that I found was a descriptive controlled study of first-year medical students. The experiment was pre and post-op testing that were compared after utilizing a PowerPoint presentation. The conclusion was to utilize the PowerPoint presentation. However, it shouldn't be everything for any particular presentation. If you are up doing a speech, it should only be an outline. You should be able to supplement that with a high-quality handout, and do not use all bulleted items on everything. The second article I found was a retrospective study. It was from 5 different universities, and it looked at over 1,700 PowerPoint presentations. It was a data collection from presentations, and then it compared it to a 9-point standardized scoring, so a Likert scale. The utilization of the 9-point standard criteria improves the quality in PowerPoint presentations for learners, is what was found in that study. The third article I found was a retrospective comparative study. It was an experiment. It was an evaluation from a recruited audience, which does make a difference in the reputableness of this study. The presentation mediums after seeing the assigned presentation is what they were looking at. The conclusion of this study was the presentation medium is only one of many points that can determine success of any presentation. The fourth literature article that I went over was that from fifth-year medical students is who was in the study. It was experiment again. This study was on assessment of the performance of students after teaching by different methods of experimental study. PowerPoint teaching is as effective as problem-based learning. The thought of assessment for students with either type of teaching method makes an impact on how much they retain and how much they learn. Overall, the literature states that PowerPoint is a useful tool when used as an outline or an adjunct to a presentation. It should not just be read. It is useful for different types of teaching and learning, respectively. It depends on whom you are teaching and how much should be on slides. There should be pictures and such for different age groups, obviously. Methodology and rationale for use based on the literature review. This PowerPoint will be effective for providing instruction to a wide array of learners and teachers alike, and I have a very large, diverse population. As I said, we are going from high schoolers to doctoral level education and a couple of MDs as well. Learning theory integration. Students are involved in more than just the listening. All senses should be utilized, and with demonstration and PowerPoint, that's actually happening. Skill developments, priority screening, and demonstration of knowledge skills are paramount in any kind of learning theory. Engage the students in activities throughout, and return demonstration of skill is always a great way to make sure that your learning and the theories that you're trying to teach have actually happened. The appropriateness of this audience, PowerPoint and demonstration has been utilized in every area of teaching and presenting. People use it in medical schools, in vet schools, in nursing, lecture, simulation, communication, lecture. Both methods, demonstration and PowerPoint, can be utilized for anybody. This is a teaching method that should be utilized to supplement teaching and education, not be all that they are seeing. If you're going to utilize a handout with a PowerPoint, you should always utilize something that is not just your notes slides. You should have something that follows your slides, but not necessarily exactly what's on them. It will also help to keep your presentation on time. Outline of the teaching content that will be in this PowerPoint. Depression knowledge pretest in a handout form. It'll be a worksheet or a survey. It takes about 5 to 10 minutes, and it will be evaluated by a post-presentation survey. How much did they learn after that in the post-test? Also in the PowerPoint will be the definition of depression via screening, and how do we come about that. That will be covered in the PowerPoint. It only takes about 5 minutes. It's pretty simple explanation. And again, that'll be evaluated via post-test. The appropriate treatment options, same thing via PowerPoint. It should take about 10 to 20 minutes to cover. And again, will be covered in the post-test. Implementation of perinatal depression screening program will be covered for 10 to 20 minutes, hopefully only about 10 minutes. And again, it'll be done in a post-test. The pretest is for identification of understanding of content and to gauge how quickly to discuss some points. Some people, dependent on my audience, will be very familiar with what screening tools are used and what validated screening tools are available. So that will make a difference in how long and how much things are discussed. The post-test, it will assess if there is further understanding of the definitions and the appropriateness of treatment and what exactly treatment should be. Demonstration portion of this presentation will be utilizing case scenarios for treatment options, and we'll actually go through and should this person be treated and with what medication would you begin. There are 2 additional resources here, both with different links on how to create effective PowerPoint presentations. And these are my references, and I thank you for watching.